crowns are one of the more common procedures that adults have done. And the reason for that is you can only fill a tooth so many times or to a certain level. Once a filling gets larger than what's left of your tooth, the tooth is not very strong. I tell people very frequently that fillings don't strengthen your teeth in any way. So when we have to remove decay, we're drilling a hole in your tooth and we're filling it with a tooth-colored filling material. And that seals it up and it's a good restoration, but it did not strengthen your tooth in any way. In fact, it did the opposite, it weakened it. So once you've had 2 or 3 rounds of that, if the silver filling you had when you were a kid was replaced and then 10 years later you have a new issue, we move to a crown. And a crown is really just like a hat that covers the tooth. So instead of that weakening process with a really large filling, we just cover the tooth. So 360 degrees around, the tooth is kind of hugged and the tooth is now strengthened. From the patient's perspective, it chews like normal, it brushes and flosses like normal, looks like normal. It probably looks better than it did before we started. So a very common procedure, should be very comfortable for the patient. It's not a painful thing either while they're here or when they go home. So dental crowns are a very important restoration in dentistry.